Immunotherapy given in the form of an immune checkpoint inhibitor to patients with advanced or metastatic cancer was significantly more effective in men than in women, regardless of the type of cancer, line of treatment, or type of drug administered, a systematic review and meta-analysis indicated. For male patients, the results showed that men treated with an immune checkpoint inhibitor given either alone or as combination therapy had a 28% improvement in overall survival (OS) compared with men who served as controls, at a hazard ratio (HR) of 0.72, 95% C 0.65 to 0.79, reported Fabio Conforti, MD, of the European Institute of Oncology in Milan, and colleagues in Lancet Oncology. In female patients, the OS benefit from immune checkpoint inhibitor therapy was smaller relative to the control treatment, at an HR of 0.86, 95% C 0.79 to 0.93. The difference in survival benefit between men and women treated with immunotherapy was statistically significant at p equals 0.0019. Immune checkpoint inhibitors have revolutionized cancer treatment, showing higher efficacy than standard therapies in several cancers. But while the results of this study show that immune checkpoint inhibitors can improve overall survival for patients of both sexes with some types of advanced cancers, such as melanoma and non-small cell lung cancer (NSCLC), men have a larger treatment effect from these drugs versus control treatments than do women, the researchers wrote. Patient's sex should be taken into account in the assessment of risk versus benefit, as an important variable predicting the relative benefit of anti-PD-1, programmed cell death protein 1, or anti-CTLA-4 drugs compared with available standard therapies. The review and analysis included 20 randomized controlled trials involving 11,351 patients. Approximately one-third of the group had melanoma, and another third had NSCLC. The other cancers included in the analysis were renal cell carcinoma, urothelial cancer, and head and neck cancer. The drugs involved included ipilimumab, Yervoy, tremelimumab, nivolumab, Opdivo, and pembrolizumab Keytruda. Two-thirds of the patients were male, one-third were female. The investigators analyzed OS for each cancer histotype treated, the line of treatment received, the type of immune checkpoint inhibitor administered, and the type of control treatment used in each randomized controlled trial. The magnitude of efficacy of immune checkpoint inhibitors was greater for men than for women, and the heterogeneity test for this sex-related interaction, assessed within each subgroup, was not significant, the authors reported. In fact, the pooled reduction in mortality risk for male patients was essentially double that for female patients. The results also indicated that the consistently increased benefit of immune checkpoint inhibitors in males compared with females was apparent regardless of whether an anti-PD-1 or an anti-CTLA-4 inhibitor was used. Conforti et al. Noted that researchers evaluating the benefit of new therapeutic approaches like immune checkpoint inhibitors rarely consider sex in their assessment of the treatment effect on the tumor being treated. Therefore, the Lancet Oncology authors said, any new trial designed to test new immunotherapy approaches should make every effort to recruit more women into the trial to avoid extrapolating results to women when the findings really applied only to men.